Los Angeles construction worker, an average day on the job was about to become a nightmare. 20-year-old Cliff Meidel had recently taken a job as an apprentice for a local building company.
I was working as an apprentice plumber on this construction site, and it was just a normal type of day. You have your coffee, you go to work, and I was instructed to use this jackhammer.
As he focused on breaking up a section of concrete, Cliff's jackhammer hit an unmarked power line. In an instant, 30,000 volts shot through his body, exploding out his back and exiting through the ground contact at his knees. As paramedics struggled to keep him alive, he went into cardiac arrest 3 times. The 30,000 volts of electricity that exploded through Cliff's knees had burnt both kneecaps and their attached tendons beyond repair. Because of the high risk of deadly infection to the exposed tissue, his doctors recommended amputation. Cliff's mother, frantic for an alternative, contacted Dr. Malcolm Lesavoy, a reconstructive surgeon at the UCLA Medical Center.
She told me that he was on the schedule to have both of his legs amputated above the knees that following morning. And so it was a somewhat urgent situation.
Lesavoy proposed trying a radical procedure borrowed from reconstructive surgery. He would cover the knees using a section of Cliff's calf muscle and hope that it would take. The risky procedure worked. Cliff got to keep his legs, but there was little chance he would ever walk again. After weeks of agonizing struggle, Cliff built up enough arm strength to get around on crutches, and doctors allowed him to go home.
I kind of had to teach myself over again, okay, this is how, you move this leg forward, and this is how you move that leg forward. Doing the physical therapy in the pool, that it allowed me, I could put all the weight that I wanted on my body. And the parallel bars kind of helped me learn how to walk and get that muscle coordination back that I had lost.
This hard-won freedom only made him wonder what else might be possible. One day, he caught sight of a local rowing team.
Then I remembered this canoe paddling sport that I did one time when I was 16, and I thought, hey, this is going to be a great avenue for me to get into sports because I didn't have to use my legs, it was all upper body.
Cliff's persistence paid off. In 1996, he tried out for the U.S. Olympic kayaking team and made it. 4 years later, at the 2000 Olympics in Sydney, Australia, he returned and was chosen by his fellow Olympians to carry the American flag in the opening ceremony.